Okay, just going to make another video now. This one's on the topic of amitriptyline. Just to introduce myself, I'm Dr. P. I'm a general practitioner, hang on, that's better. I'm a general practitioner, which is a family doctor in the state of Queensland, Australia. Amitriptyline is a very old-fashioned drug, been out for a long time, been out for probably 40 or 50 years, I suppose. It's tricyclic. It was called a tricyclic antidepressant, which is a TCA, and it was one of the first antidepressants before we got all the new ones. In Australia, usually sold under the name Endep. Very useful medication, has a multitude of effects. Unlike the new antidepressants, which really only work on serotonin and sometimes noradrenaline, amitriptyline affects those two, but it also affects histamine and muscarine and adrenaline and all sorts of things. So it's a very complex drug, which can have some quite complex actions, can be incredibly effective, can have some bad side effects, not very nice in overdose. Not used as much as the newer, cleaner ones, but sometimes the old drugs were more potent and work better. Comes in a dose of 10 milligrams, 25, 50. The therapeutic dose, or the dose that people end up on, look, you can start off low and go slow if you're increasing it. Some people can end up on quite high doses for treatment of depression, up to 150 or 200 milligrams. But a lot of people who use this drug, because it has such wide effects, I'll just talk about what it's actually useful for. It can be very useful for depression. It can be very useful for sleep. It can be very useful for chronic pain. It can be very useful for anxiety. It can be useful for nerve pain. It can be useful for migraines. It can be a bit of a sleeper. Like, it's got a whole stack of things that it's used for. But it generally, people start off on a very low dose because it can be quite sedating. It can make you put on a bit of weight. It can make you feel a bit spacey. It's not addictive. And yeah, it's probably not as clean as the new drugs. As I say, it's got more side effects. So it because it affects all those different systems, it can have effects on a very dry mouth, which is one of its main side effects. It can have effects on urinary retention. So elderly people sometimes can't empty their bladder, can't go to the toilet, constipation. It's sedating. It can cause weight gain. So it's got a few different effects, but it's still a very useful medication. It's used a lot for chronic pain, the chronic pain of back pain, the chronic pain of cancer pain, the chronic pain of many irritable bowel syndrome. Many conditions benefit from low doses, and sometimes even higher doses that are slowly therapeutically increased of amitriptyline. It's one of those ones where it's better than being on a narcotic, which is going to be addictive and which is going to become less effective with time. The amitriptyline seems to not have that effect. If it works, it can, you can stay on it for a long period of time and you're not going to get addicted to it, and you're going to get the ongoing benefit. In overdose, quite dangerous, has effects on the heart arrhythmias, can be fatal. If you take an overdose, you can end up in intensive care. But that's amitriptyline. Okay, thank you very much.